In this video, we suggest a new approach of implanting iStent through combined surgery with phacoemulsification to correct the astigmatism a little bit in the eye. This patient has astigmatism with the rule. This means the steep axis is 12 o'clock. So we will put the main incision at 12 o'clock and implant iStent through a side port. To do phacoemulsification, we use a stop and chop technique in this surgery. So we divide the nucleus for 2 halves, then we take each half alone. We finish the first half of the nucleus, so we will crack the second one here. We're using a chopping technique. At the end, we will implant the lens and use irrigation aspiration to remove cohesive viscoelastic. We will seal the wound with hydration, the main incision at 12 o'clock. Then we will move the microscope a little bit, approximately 9 degrees. We put right now myocol in the anterior chamber to get meiosis of the pupil so we can do the iStent implant. So we move the microscope 90 degrees. We put more viscoelastic through side port. There's an air bubble in the anterior chamber. So we have to absorb this air bubble to get a clear view of the trabeculum. We'll put more viscoelasticum over the cornea, and we'll move the head of the patient and the microscope approximately 35 degrees to get a clear view of the trabeculum. Then we'll put the prisma. The trabeculum here is well pigmented. We get our inject through side port, and we will implant the first iStent. We see a very good blood reflex, and we will implant the second iStent approximately 2 hours apart from the first one. And once more, we see a very good blood reflex. We monitor the blood reflex easily and try to see if there's any kind of abnormality or excessive bleeding. Everything is okay. So we remove the prism and we will correct the position of the head of the patient, and the microscope will absorb the viscoelastic from the anterior chamber through IA. We put the irrigation and aspiration through side ports, not through the main incision at 12 o'clock. It's very well sealed. There's no leakage. So we see a little bit blood reflex from the iStent nasally, of course, but there's no hyphema. There's no clear hyphema in the anterior chamber. It's very important to get a high intraocular pressure at the end of the surgery. Otherwise, the hyphema would not be unexpected in this situation. We seal the side ports with hydration once more with BSS.